In this brief module, we will look at disease transmission within the EMS environment and precautions EMS providers can take to stop diseases from spreading to them and others. Once completed with this module, you should be able to identify means of disease transmission and precautions to prevent such transmission. As far as disease transmission is concerned, there are several types of precautions that can be taken to prevent the spread of disease. The first type of precaution is relatively simple and broad in its application. For those of you who remember the term universal precautions, standard precautions is the updated version of those practices that also incorporates body substance isolation procedures as well. Essentially, standard precautions dictates that healthcare workers must assume that all blood and body fluids are infectious and that moist body substances may also transmit bacterial or viral infections. Therefore, EMS providers must be concerned about not just infectious diseases, but bacteria and viruses that may be transmitted as well. Standard precautions apply to all body substances except sweat. Wearing gloves is a very common practice in taking standard precautions. Airborne precautions apply when dealing with large particle diseases that can travel a distance of at least 6 feet in the air before gravity takes over and the particles drop to the ground or another surface. Examples of such diseases include tuberculosis, measles, or chickenpox. To prevent against this type of disease transmission, a surgical mask should be worn by the patient or, if that is not feasible, the EMS providers. Utilizing the exhaust system within the ambulance's patient compartment, opening windows to maintain an adequate airflow, or using an air recycle function for the heat or air conditioning can also help mitigate risk of exposure to airborne pathogens and illnesses. Droplet precautions are somewhat similar to airborne precautions. The difference is that the particles are medium to large size particles that can travel up to 3 feet in the air before falling to the floor or another surface. These diseases include influenza, meningitis, mumps, pertussis, rubella, and Ebola. As with airborne precautions, droplet precautions are similar. Place a surgical mask on the patient and utilize the airflow and exhaust system within the ambulance's patient compartment. Contact precautions apply when dealing with patients who have draining wounds, bleeding, excretions, infections, lice, norovirus, Ebola, and other similar pathogens, parasites, viruses, or bacteria. Gloves should be worn when contact precautions are necessary, and it may be necessary to wear a gown if there is concern about clothing contamination. Once the patient is transported, the ambulance crew must also ensure all contaminated surfaces within the ambulance, including the cot and anything else the patient may have contacted, are properly cleaned and disinfected. Given your completion of this module, you should now be able to identify common means of disease transmission and some precautions to prevent such transmission. This presentation was prepared by Waukesha County Technical College in Pewaukee, Wisconsin, and is distributed with an Attribution, Non-Commercial, Share-alike 4.0 International Creative Commons license. Copyright 2019 Waukesha County Technical College. For information on WCTC's numerous fire and EMS educational offerings, please visit us online at wctc.edu.